One of the things I think about this opiate epidemic that people may not always realize is that it's really, it's an equal opportunity epidemic. It affects people from all walks of life.
I think it's definitely beyond a Lawrence thing. It affects all communities regardless of socioeconomic status, regardless of geographic location. It is everywhere.
I think one of the most important things is that patients can come here to Greater Lawrence for all their healthcare needs. I think a lot of our patients feel embarrassed about their addiction problems, and they maybe don't want people to know that they're here for that specific reason. So for a lot of people, it's nice they can come to the clinic and maybe they're seeing their doctor for a pap smear, or maybe they're getting their cholesterol checked. Really, they're here to talk about their addiction and to get treatment for that, but the whole world doesn't have to know.
Having your primary care doctor working with you in the clinic really allows that full breadth of services for that patient. So not only focusing on their substance use disorder and their sobriety, which is their maintenance, is really important, but also kind of caring for them as a whole.
Another big factor in removing some of those barriers is we have a pharmacy here. We have a pharmacy at all of our sites, and the pharmacists have been extremely helpful working with our patients, obtaining the medication. There's often insurance barriers that are put in the way for prior authorization or limits on how long they can be on the medication. And we're very fortunate to work closely with our pharmacy to be able to provide that service to the patients regardless of what kind of insurance problems come up.
In the clinic, we have social workers, we have nurses who are able to, fully support them. We can connect them to community resources. So I think looping them back into the medical system is really key.
We have patients who are very high functioning, who have well-paying jobs, and who, if you saw them on the street, you would have no suspicion at all that they had struggled in the past with addiction. We have patients who are homeless, who are living in a shelter, who come here, and unfortunately, if you saw them on the street, you might think that there's definitely something abnormal going on with them. We have moms who come here. We have pregnant people who come here. It's hard to say who our typical patient is. They're all different,
I think just from what we see working with these patients, and when they are successful in the program, they find that they can really start their lives again. They can reconnect with family, they can get jobs, they can be so successful. And I think that is an amazing thing. And so the more we can have to support the OBAP program, the more patients we can serve, the more lives we can save. I know that sounds kind of cliche, but it's really true. I mean, people are dying of overdoses, and we know that these are effective treatments for them. And so being able to more fully support them in any way we can, I think is really crucial and really important.